when you are, Sarah.
Oh, great. And so, Linda, vaccination rates nationally aren't as high as the federal government or anyone would like them to be. What is Labor proposing to do as a solution to kind of turn this around?
We have a 4-point proposal, and we're really urging the federal government to take it up. The first is coordination and making sure that the community, particularly community Aboriginal-led organisations like this fantastic organisation called Tarawul that I'm at today, to be absolutely fundamental to that coordination. We're asking for local data to be provided. It's all very well to get the national figures, but local data provides the information we need to be able to work out what needs to happen. We're really saying that it's important that it's explained to First Nations people what the implications are if you don't get vaccinated and what it can mean in terms of your health outcomes, particularly in small communities where there's no medical facilities. And of course the really important thing is to make sure, as I said, that coordination takes place and that Aboriginal people are leading and that cultural sensitivity is really important. I'm out here at Tarawul. There's 250 young people going through the vaccine clinic today. They're all getting a steak sandwich at the end of it. They've got their families with them. It really is a fabulous example of an Aboriginal-led organisation and what is possible, whether it's in Campbelltown or Collarenebri.
And the government says that it's working with nachos, through Nacho and others with the Indigenous COVID response task force. Do you think more is needed to ensure a nationally consistent approach and kind of tailor-made that for different jurisdictions?
Well, that's the fourth element of what Labor is saying, Sarah, and that is that there needs to be a national plan. Playing whack-a-mole where an infection comes up is just not going to cut it. There needs to be a national approach to the way in which COVID is rolled out across the communities in Australia. It's not rocket science. The communities are known, people are familiar with them, and it is the way in which it can work with Aboriginal communities. But whack-a-mole, sending the ADF in when there's a problem and finding vaccines where there aren't any to start with is just not going to do it.
And outback and regional cases in New South Wales in particular are growing. We're seeing a further rise in cases. Does there need to be further restrictions or a ring of steel around Sydney?
Look, I actually think that people are working really hard. I mean, the electorate that I represent is in really hard lockdown. 3 of the LGAs of concern cover the electorate of Barton. People are working hard, and it's just so crucial that community leaders and trusted people are in the front lines. Otherwise, there is mistrust, there is a lack of understanding. What really works in small Aboriginal communities is a door-to-door approach. I hear today that they're going to test Wilcannia. Well, there's 700 people in Wilcannia. You can stand in Wilcannia and see just about every house. It's not a hard thing to do.
And there's been other jurisdictions around the world, particularly in New Zealand and Canada and others, that do an ethnicity breakdown for their vaccination rollout, particularly focusing on Maori and Indigenous communities, providing that real-time data snapshot. Does that need to happen here so we can see exactly what's happening?
Absolutely. Labor has called for several days ago that the federal government produced two things, and they've got the data, that's obvious. First of all, we're calling on the federal government to say how many Aboriginal people have been vaccinated, and secondly, the availability of vaccines. We saw what happened in North America. We've seen what happened in places like Brazil with just devastating impacts on First Nations communities. Unless the data is available, it is very difficult to plan. And that data should be released, and Labor has been calling on that for several days.
And the success of the COVID situation for First Nations community has been really heralded rightly as a success by Indigenous groups and people, but also the government. Do you think that this period is now under threat? Has that ended?
There is no way the government can rely on the rhetoric that we're doing well in Aboriginal communities. What this has exposed is very poor rates of vaccination in some jurisdictions. I mean, and the numbers tell the story. We've got 8% vaccination rates here in New South Wales, yet in Victoria it's about 47%. The difference is that Aboriginal community controlled organisations were put in charge of the vaccine rollout in Victoria. They were trusted, and the success is in the numbers.
Linda, I think that's everything I wanted to
Oh,
ask.